this is a first case, and as you can really see here, there is not much of chromosomal abnormalities except of one small copy number increase. You can really see it on chromosome 17. Next slide. And if we focus on this particular focus, we see increasing copy number in ERBD2, CDK, as well as the MET genes in this particular patient. Next slide. When we run this case through our algorithm, this particular case really is diagnosed by our algorithm as lung cancer, and we can see between lung cancer there is significant overexpression of ERBB2 messenger RNA corresponding to the copy number amplifications, and as you can see, the RNA is expressed at 8.14 folds higher than lung cancer. There is also what's interesting, if you look at the bottom circle, there's MET gene overexpression to the gene copy number variation. But there's something else also very interesting about this particular patient. There is overexpression of FGF23 messenger RNA. This particular gene is very relevant for, it has been reported that it plays a significant role in osteomalacia. And perhaps cancers that overexpress this particular gene will have higher tendency of causing osteomalacia and metastasis to bone. So this is just a side where we are really trying to track these cases. Next slide, please. For mutation-wise, as you can really see here, we find mutation in the MYC genes, and we find mutation in the TP3 and other genes. But the tumor mutation burden is low. Next slide. So the major abnormalities in these patients are practically the HER2 gene amplification and overexpression, the MET also overexpression and amplifications, and in my opinion, the CDK12 amplifications because of implication of all these abnormalities on treatment. So Dr. Gutierrez, want to comment on this, please?
Good evening. Can you hear me?
Yes, we can.
Thank you. So this is actually a 62-year-old patient who was a former smoker with a significant history of diabetes, and a part of a evaluation by a primary care physician with a question of pneumonia lead to find a large mass in the upper lobe. The PET scan was very positive with ACV of 12.5. Went for surgery, he didn't have non-metastatic disease. He was found to have a T4N1 disease of a lung cancer. So clearly these results are very helpful. The patient cannot decline adjuvant therapy, and we're in the process to scan the patient right now. Clearly, having decreased chemotherapy, having an overexpression of ERBB2 opens me the door for potential treatment with ERBB2, with Herceptin specifically. There are several case reports with a 51% response rate on Herceptin on patients with lung cancer who has overexpression of ERBB2. As well as a second line with a TDN1 with a 40% response rate. So clearly this will be very helpful in case that he needs further treatment. He already has declined chemotherapy once, so going to another more targeted therapy will be helpful.
Great.